The major reason for getting the flu vaccine for people who work in hospitals is it's a patient safety issue. Young, healthy adults, when they get the flu, generally do okay. They're sick for a while but can get over it. Elderly people, immunocompromised people, we can give it to them and it can make them awfully ill and actually kill them. It's just sort of like the last nail in the coffin if somebody's very, very ill. Everybody ought to get the flu vaccine. It reduces illnesses during the wintertime. It reduces absenteeism from work. You may give it to somebody who is a mother who is pregnant, who can have horrible complications. You may give it to an elderly person or someone who has some other underlying illness and make them horribly ill. So there's lots of reasons to do so. It's just a good annual health measure. Well, and I hear that a lot, but actually people who say they never get the flu actually do. We know pretty well that you get the flu every 3 or 4 years. But in healthy people who get illnesses that feel like a cold or just a viral upper respiratory infection, often in flu season that's actually the flu. And healthcare providers, being pretty compulsive individuals, are not going to stay at home just because they have a cold. They're going to go in and say, this is silly, I'm not going to miss work, it's just a cold. But it's actually influenza, and they go into work and then they infect elderly and immunocompromised people and kill them. So again, the main reason it's a patient safety issue. And if you don't think you're getting the flu, you're wrong, you do. Well, and that's all well and good, and those are things you should do, but one thing about influenza is that for a couple of days before you actually become ill from flu, you're excreting the virus. So the notion that you can stay home when you get sick doesn't work very well, because you're going to come to work for those 2 days beforehand and you're going to be excreting the virus and you're going to be infecting our immunocompromised patients. Well, no, actually the vaccine cannot give you the flu, and it is a killed preparation of the virus, and it's just, there's no live virus there to infect you with. I do hear from folks that they've gotten the vaccine and then they get the flu anyway. A couple things can happen. One is that unfortunately the vaccine's not 100% protective, so there are individuals who get the vaccine who do go ahead and get the flu. Other things can happen. You can have an infection that's not flu, that feels just like flu, or you get the vaccine too late and your body doesn't have a chance to build up the immunity to the flu, and it just kind of sneaks in sort of under the wire. Well, there are some exceptions, but in the main, it's a very, very safe vaccine. We've used this for 30 plus years. There's millions of doses given every year. And if there was a serious systematic problem with the vaccine, we would have discovered it a long time ago. And it's amazing. It really is. It's amazing the opinions that physicians have about the vaccine that are simply not borne out in fact. And there's extreme, huge amounts of scientific data on the safety and effectiveness of the flu vaccine. And it's medically indisputable that it's a good idea.